healthcare workers like myself who have direct patient contact and the possibility of getting others sick can't even get tested. I just want everybody to let that sink in. I have trouble getting tested, and I work at a hospital that just today I was literally in a gown, a mask, another special mask, special gloves, doing a test on somebody else, and I still can't get tested unless I have symptoms. But you know who can get tested? Tom Hanks can get tested, and his wife Rita Wilson can get tested, or the entire Brooklyn Nets basketball team can get tested since their team owner has the funding to hire a private lab to test people. And I'm pretty damn sure that Jeff Bezos or Bill Gates would have no problems finding tests if they could slither out of whatever safe house they're currently hiding in. And I think that these are just some of the disparities in testing that we see under capitalism. But even if the US had widespread testing, it would still be nowhere near enough. And I think that that's really key. Under current policy, widespread testing would be free to testing. But one of the questions is, what about treatment? As reported by CBS News recently, the recent COVID relief bill provides, quote, free testing and expanded funding for food security programs and paid sick, family, and medical leave for workers at companies with 500 employees or fewer. But there are still questions over if there's needed medical care, if that would be covered. The question is really important because medical bills are the number one driver of bankruptcy in the US, and long hospital stays for a family member with coronavirus could lead to economic ruin. This leads many to be less likely to seek care when they actually need it. And with recent bills for paid sick leave not covering 80% of US workers, it also leaves workers who are ill more likely to continue trying to work and hence spread the virus to others. Just this week, a panel appointed by New York's Governor Andrew Cuomo unveiled on Thursday its plan to reduce Medicaid spending by some $400 million, because that's at all logical.